What is pancreatic cancer? Basically, the pancreas is a fatty filled structure which is located in the posterior part of your body. It is sort of lying against the spine. The main functions of the pancreas, the most important functions, though it has several functions, the most important functions are, one is insulin and glucagon production, by which it regulates your sugar levels, and also the pancreas produces a lot of enzymes that are involved in digestion. Among the enzymes the pancreas produces, it's very important for fatty food digestion. So the pancreatic tumors, the tumors or cancers which occur in the pancreas are several types. You have basically the three broad varieties. You have pancreatic adenocarcinomas, you have cystic neoplasms of pancreas, and neuroendocrine tumors. So most of the time when we're talking about pancreatic cancer, we are talking about pancreatic adenocarcinomas. So these are very aggressive tumors, pancreatic adenocarcinomas, and they generally tend to have not a very good prognosis. They are poor prognosis tumors. So the pancreatic adenocarcinomas, they arise from the ductal lining of the pancreas. The pancreas, obviously the pancreas secretions have to reach the intestine. They do so through a small duct, and the lining cells of this duct actually become cancerous, and they lead to adenocarcinomas. So pancreatic adenocarcinomas are similar to what we see in the intestinal cancer and the gastric cancers. So they are from the glandular cells. The other types of pancreatic tumors, one is the cystic neoplasms of the pancreas. These are less common, but again in a referral centers like ours, we see them fairly commonly. Cystic neoplasms are of several types, such as mucinous cystadenomas, solid papillary neoplasm, serous cystadenomas, and IPMN. These kind of cystic neoplasms, they are relatively less aggressive than pancreatic adenocarcinomas. So most of the time they grow to a fairly large size slowly over years, and they don't spread much to other structures like lungs and liver. Less common, the spread is much less common than pancreatic adenocarcinomas. So once you do surgery, the cure rates and success rates for this treatment of the cystic neoplasms is very high. The third variety is neuroendocrine tumors. The kind of tumors which say Steve Jobs had. So these neuroendocrine tumors, again, unlike adenocarcinomas, they are very slow growing tumors. Not all, but especially the low grade and the intermediate grade neuroendocrine tumors. The high grade neuroendocrine tumors behave like adenocarcinomas, but the low grade and the intermediate grade neuroendocrine tumors, they are very slow growing tumors. For example, a pancreatic adenocarcinoma which starts in the pancreas can spread to the lungs and liver. The patient's survival is usually less than a year. But while a neuroendocrine tumor can spread to the liver and the lungs, patient can go on for many years, can survive for up to 20 years also they can survive, despite being a stage 4 tumor.